Hi, I'm Gail Swartz. I'm a registered nurse on the Trauma Burn Step-Down Unit, and today I'm going to cover Epicel, which is CEA, cultured epidermal autograft. So this is going to be a new process that we're going to be trying on some of our burn patients. So we acquire a biopsy from the patient. The biopsy should be acquired early on to prevent any sort of infection that the patient can acquire later on with long-term burn care. So if we do the culture early and we send it to the company, there's no fee to the patient or the hospital until we request the cells to be cultured. So it's recommended to get it early. It's for total surface area of greater than 30%, or if there's not adequate sites for grafting. So basically they're going to do a mesh graft and then apply the Epicel over it. The initial mesh graft will be a scaffolding for the cells to fill in. There'll be 4 to 5 layers that will actually cover the graft site after it's done. And then what will happen is the patient will go to ICU, where for 1 to 7 days post-operatively, only the outer dressing will be removed. The part of the dressing that will remain will be anything under this veil. We will not disturb that. That will be considered takedown when we take the veil down and actually expose the full graft. There'll be no range of motion over the grafted joints. And what will happen is once the dressing's taken off, it will be left open for 4 hours so that the grafts will be able to dry and culture and get some air. At that point, we will redress them. At the initial takedown will be done very carefully to prevent any tearing or shearing of the graft. For easy removal, we can use saline or SureCell, which is a product sold by the company that will be doing the cell cultures for us. The problem is to avoid scrubbing and avoid abrasion, because as you can see that there is actually easy shearing because the cells are so thin. So during post-op takedown, full range of motion can be done across the joints. Once the joints are dressed, you need to be careful because you can't see what's going on underneath the dressing when you do range of motion. Long-term care, which will be 21 days plus post-op, will be like any other burn patient. And as you can see, we're going to wash with mild soap. We can moisturize. We're not going to remove any blisters unless they're infected. We'll use pressure garments. Activity is tolerated. We'll avoid sun exposure. And in the end, this is an example of what the Epicel graft will look like 3 years post-op. Because hair follicles are not culturable, that area of the skin will no longer grow hair. Okay, thank you.